Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We'll be speaking with Mina B. She's a licensed mental health professional. She's going to talk about her brand new book, Owning Our Struggles. It's a very important book advocating for mental health inclusivity. She also will be talking a little bit about how community care is just as important as self-care. She'll touch on cultural healing practices, building healthy relationships, holding yourself accountable, and healing parent-child relationships. A lot to cover in just a short period of time. Welcome to Health Professional Radio, Mina B. Thank you.
Thank you for having me. Hi, Neil.
Hey, nice to meet you. Thank you so much for joining us here on Health Professional Radio. Give our listeners a little bit of insight into who Mina B is as a writer, author, and the founder of Mina B Consulting.
Yes, well, I am a licensed social worker, which is the foundation of the work that I do. I earned my master's in social work from NYU, New York University, and I went on to be a therapist for about 9 years. During my work as a therapist, I specialized in treating anxiety, depression, and trauma in adults. And I also worked in early Head Start in New York City, where I worked with children ages 0 to 5 on their social emotional development, as well as working with their families and the school staff as well. And that is what really led me to do the work that I do now publicly.
Now, you've got your new book just published this week, Owning Our Struggles, advocating for mental health inclusivity. Your book stresses community care as an important aspect of mental health care. Is it a myth or old medicine, for lack of a better term, that, you know, your mental health is your own business between you and whoever you decide to be a therapist, or simply you and yourself?
You know, I think that's a really good question, and I think that stems from this idea that we are responsible for our healing, which we are, right? And so when you think of your mental health, you are responsible for doing the work of healing your trauma. You are responsible for doing the reflective work to see how you navigate through the world, checking in on your biases, checking in on the things that impact you emotionally and how you handle your emotions. But I think what's often missing from that piece is really reflecting on how you contribute to the world around you. Because if we are in a traumatized body, that means we have a high potential to traumatize other bodies, right? And so I think it's really important for us to be thinking about, yes, my mental health is my responsibility, because if I don't do the work of taking care of my mental health, I am now impacting the people around me, and we're all wired for relationships. And so we might see things manifesting in our friendships, in our romantic partnerships, even when we're at work and how we interact with people to build interpersonal relationships. It is a reflection of the own inner work that we're doing, because it trickles out to our community.
So instead of woe is me, it's woe to the whole community based on my mental stability or lack thereof, right?
Yes, exactly. You know, and if we're not doing our healing work, we have the potential to continue to create ruptures in our community spaces as well.
Although it was always in existence, these disparities in healthcare and things of that nature, the pandemic really shed a bright light on some of the practices and trends in healthcare, mental health care specifically, that exist. Are there certain communities, certain groups of people that are more likely to experience the stigma associated with mental health, or distrusting psychologists, psychiatrists, social workers, or is everyone experiencing the same things?
You know, even though it is true we are all experiencing the same things, because we are all susceptible to mental health issues, and mental health can also be tied to our society. So even as you mentioned, the coronavirus pandemic, we were all impacted by that, regardless of your race, regardless of your gender. But there are also certain groups of people who are more predisposed to dealing with chronic health issues. And so we saw it in the Black community and even in the Latin community, right? Them experiencing higher rates of COVID, especially because they made up a large percentage of essential workers who had to go out every day. Now this ties in the concept of capitalism. Also, when we think of mental health, for example, Black women have a higher likelihood of dying during childbirth compared to any other race. So all those things can happen across all spaces. BIPOC individuals, and I'm going to speak specifically to Black individuals, we are more prone and more susceptible to dealing with mental health related issues. And I think the number one thing that is often missing from the conversation around mental health is going back to ancestral and historical trauma and really paying attention to how when our ancestors were finally free from slavery, right? And I'm saying free in quotation marks because people can't see me, right? Because we know those things are still manifesting systemically and institutionally. Mm-hmm. But the thing was, our ancestors experienced historical trauma, which is a form of trauma that targets a group of people, specifically because of their race. And so that is what slavery was, a form of historical trauma. But now here you are. We have a law. You're free now. But if you have been dealing with trauma your whole life, trauma is literally embedded in your DNA because trauma can alter your DNA. You come from a family lineage of trauma. Now it's intergenerational. How do you now learn to integrate into a free society that is now offering you health care, that is now offering you mental health healing, that is now offering you a trauma-informed atmosphere to help you overcome the psychological, mental, and physical effects of slavery? We didn't have that.
No. And obviously, why would someone in that position trust that all of a sudden you've made this, this whole turnaround and now you basically love me, enough to help me?
Yes.
When just yesterday I was...
Exactly. I was 1/4 human, right? I wasn't even considered a whole person. Now you want to diagnose me. Now you want to talk about my feelings. And so this is why it's more prone for the Black community to self-segregate and look inward for their healing, because it's hard to trust a society that even in 2023 is still trying to oppress you in systems and in laws, right? And so that, I think, is a very important conversation to have around stigma, because, yes, we have personal responsibility over ourselves, but we also need to think about the context of what trauma is. And trauma impacts us on a societal level, which is why stigma should not be placed on the backs of Black people to break. Stigma and in the Black community still exists because, as I shared, even in 2023, we have this data that shows that Black people are more susceptible to medical racism. They're more susceptible to this type of treatment in the healthcare system. And so that distrust is a community care issue.
Well, how do you hold yourself accountable for your potential for both the good and the bad actions and the thoughts when dealing with your mental health, when your mental health is very likely related to the systemic racism, these disparities in healthcare? How do you keep yourself in check so that you go out and not, seek revenge?
Yes, I love that you said that, because that is a trauma response. I'm seeking revenge because my body is in a state of fight mode. My body is in a state of rage. And so I want to, maybe engage in certain behaviors because I'm in a traumatized state. I think holding ourselves accountable is so important, because it's really all about focusing on the things that we can control, because we do know there is a larger system at play that we cannot control. And I believe that Black people have a right to joy, and we have a right to live in the lives that we believe we deserve. And we have to be aware enough to know that the system is not going to give it to us. We have to create it, and we have to cultivate those safe spaces for ourselves and for our communities. And so holding yourself accountable really means being reflective about how you show up in the world. And so it's like saying to myself, I know what it feels like to be traumatized. So let me do the work of, one, investigating my trauma history. And that work could look like maybe seeing a therapist, predominantly maybe a Black therapist and someone who is culturally competent to really work with you on issues that are happening in society as well that is impacting you and your race. But also, what can I do to be reflective of the things that are causing me pain, so that I can develop healthy mechanisms, because I deserve joy. I deserve peace in my life, right? And so one of those things that I talk about in our Black community is the power of cultural and ancestral